Hello and welcome. I'm Mo, and this is my very first video on the channel. Today, we're diving into a super important topic, testosterone, the body's main male hormone. Before we get started, if you're into health, fitness, and sports science, hit that subscribe button and ring the bell so you don't miss any future videos. In this video, I'll break down testosterone in simple, scientific terms. What it is, how your body makes it, its many functions, and the health benefits and risks it can bring. My goal is to give you accurate, reliable info, because so much out there online is either wrong or overhyped. As a personal trainer and sports physiology researcher, I've noticed a lot of young people either treat testosterone like a magic muscle building pill or fear it way too much. By the end of this video, you'll understand your body better and be able to make science-backed decisions instead of believing myths. Remember, this is for educational purposes only, not medical advice. If you think you have a health issue, always consult a qualified doctor. Ready? Let's embark on our journey into the world of testosterone. What is testosterone? 1:35 o'clock. Testosterone is an androgenic steroid hormone. In plain terms, it belongs to the steroid family and drives male traits. It's the primary male hormone in our bodies, but note, both men and women have it, just at vastly different levels. Chemical structure. Chemically, testosterone's formula is C19H2802, made up of SHOL-1, 4 interconnected carbon rings, the steroid backbone. 2. A hydroxyl group, OH, crucial for biological activity. 3. A ketone group, equal sign O, that helps it bind to receptors. 4. A fat-soluble nature that lets it cross cell membranes easily. An interesting fact, testosterone converts into other hormones in your body, DHT, dihydrotestosterone, via the 5-alpha reductase enzyme, about 5 times more potent in tissues like the scalp and prostate. Estradiol, a form of estrogen, via the aromatase enzyme, especially in fat tissue. These conversions explain why the same hormone can promote facial and body hair, yet also cause male pattern baldness. DHT is the culprit behind genetic hair loss. Historical discovery. The story of testosterone's discovery is fascinating. Ancient civilizations knew testes influenced masculinity and even used animal testes in folk remedies. In 1849, German scientist Arnold Berthold showed that testes secrete something into the blood that affects male traits. In 1889, Charles-Édouard Brown-Séquard injected himself with animal testis extracts and claimed he felt stronger. The real breakthrough came in 1935, when Ernst Lacour in the Netherlands isolated pure testosterone from bull testes, using 100 kilograms of tissue to get just 10 milligrams of hormone. That same year, Swiss chemist Leopold Ruzicka created the first lab-made testosterone, paving the way for mass production. At first, testosterone therapy wasn't available to the public. It became more widespread medically only after World War II, before which hormone treatments were primitive and risky. How is testosterone produced? 5 o'clock, 10 o'clock. Sources in the body. Your body makes testosterone mainly in 3 places. 1. Testes, men. About 95% of total production. 2. Adrenal glands, both sexes, small amounts. 3. Ovaries, women, very small amounts compared to men. This explains why men have 10-30 times more testosterone than women. The hormonal pathway. The production process involves multiple organs. 1. Hypothalamus releases GnRH, gonadotropin-releasing hormone. 2. Pituitary gland responds to GnRH by secreting LH, luteinizing hormone, and FSH, follicle-stimulating hormone. LH tells Leydig cells in the testes to make testosterone. FSH supports sperm production. 3. Leydig cells in the testes produce the hormone. This pathway uses negative feedback. When testosterone levels rise, GnRH and LH release drop, keeping things balanced. External testosterone throws this off, shutting down your body's own production. Also, your blood carries testosterone in three forms. Tilde 60% bound to SHBG, sex hormone binding globulin. Tilde 38% bound to albumin. Tilde 2% free, active. Factors like age, health, diet, and exercise affect these ratios. For example, obesity lowers SHBG, raising free testosterone, influencing factors. Key things that change your natural testosterone levels. 1. Age peaks around 18-25, then declines approximately 1-2% per year after 30. 2. Chronic stress raises cortisol, which suppresses testosterone. 3. Sleep quality. Poor sleep can cut levels by up to 15%. 4. Nutrition. Lacking healthy fats, zinc, or vitamin D hurts production. 5. Body fat. More fat means more aromatase activity converting testosterone to estrogen. 6. Exercise. Resistance training spikes testosterone temporarily. Less common but powerful. Intermittent fasting and high-intensity interval training, HIIT, boost testosterone more than steady cardio. Plus, 15-20 minutes of daily sun exposure ramps up vitamin D, essential for hormone production. Testosterone's functions, 10 o'clock, 18 o'clock. Sexual reproductive roles. 1. Genital development during fetal growth and puberty. 2. Sperm production, crucial for healthy sperm. 3. Libido, key driver of sex drive in both sexes. 4. Erections, supports nitric oxide receptor function. Fun fact, many people think testosterone directly causes erections, but nitric oxide is the main actor. Testosterone just helps the receptors work. Musculoskeletal effects. 1. Muscle growth via protein synthesis and fiber enlargement. 2. Strength, improves force production in muscle cells. 3. Bone density by boosting calcium deposition. 4. Connective tissues, strengthens ligaments and tendons. Testosterone also shifts your muscle fiber distribution toward more fast-twitch type 2 fibers, giving greater power and speed. Psychological cognitive impacts. 1. Mood-balanced levels foster confidence and optimism. 2. Cognitive function influences spatial memory and logical reasoning. 3. Motivation linked to competitive drive and goal pursuit. 4. Depression risk. Low testosterone can worsen depressive symptoms, especially in older men. Research also shows moderate testosterone supports calculated risk-taking and better financial decisions. It even affects emotional memory, dampening the intensity of strong emotional events. Fat metabolism energy. 1. Fat distribution guides where your body stores fat. 2. Insulin sensitivity enhances cellular response to insulin. 3. Metabolic rate increases calorie burning and fat loss. 4. Cholesterol balance impacts HDL, good, and LDL, bad, levels. There's a vicious cycle. Low testosterone leads to more fat, and excess fat lowers testosterone. One of the biggest hurdles for men struggling with obesity. Other key roles. 1. Red blood cell production stimulates erythropoietin in the kidneys. 2. Immune modulation regulates inflammation. 3. Cardiovascular health improves blood vessel function, may lower atherosclerosis risk. 4. Skin hair affects oil production and hair density via DHT conversion. 5. Vision. New studies suggest roles in retinal health. Surprising tidbit. High testosterone can reduce smell sensitivity, partly explaining why women generally have a keener sense of smell. Naturally boosting testosterone. 1. Balanced diet. Focus on healthy fats, zinc, magnesium, vitamin D. 2. Resistance and HIIT workouts. Best for hormonal spikes. 3. Quality sleep. Aim for 7-9 hours nightly. 4. Stress management, meditation, breathing exercises. 5. Limit alcohol and quit smoking. Both depress levels. 6. Sunlight exposure. 15. 20 minutes daily for vitamin D. 7. Supplements. Ashwagandha, maca, zinc, vitamin D3, magnesium. Insider note: everyday chemicals like BPA and plastics, synthetic fragrances, and some pesticides mimic estrogen and weaken testosterone's effects. Opt for natural personal care products and reduce plastic use to help maintain hormone balance. Medical treatments for low testosterone, 26 0030 00 is SINO. When to consider therapy: 1. Confirmed low levels 300 ngdl by blood test. 2. Clear symptoms: fatigue, low libido, muscle loss, depression. 3. Failed lifestyle changes after 6 months. 4. Underlying medical causes: pituitary disorders, testicular injury, chronic disease. Important: always investigate root issues like obesity, thyroid problems, or vitamin D deficiency before jumping to hormone therapy. Hormone replacement options: 1. Intramuscular injections, enanthate cypionate, every 3 weeks. 2. Topical gels for daily steady absorption. 3. Transdermal patches changed every 24 hours. 4. Oral buccal tablets under the tongue, rapid uptake but frequent dosing. 5. Subcutaneous pellets lasting 6 months. Injections and gels often suppress sperm production, but alternatives like HCG or clomiphene citrate can raise testosterone while preserving fertility. Ideal for men planning to father children. Risks: side effects: 1. Testicular shrinkage from halted natural production. 2. Acne and oily skin. 3. Elevated red blood cell count, possible clot risk. 4. Gynecomastia due to estrogen conversion. 5. Prostate enlargement, requires regular monitoring. 6. Mood swings with hormone fluctuations. 7. Lower HDL, good cholesterol. Note: testosterone therapy isn't a magic shot. It demands careful medical follow-up every 6 months, including blood counts, liver function, lipid panels, and prostate checks for men over 40. Alternative medical approaches: 1. HCG, human chorionic gonadotropin, to stimulate natural production. 2. Aromatase inhibitors to reduce estrogen conversion. 3. Clomiphene citrate to boost LHFH from the brain. 4. Thyroid evaluation. Treating dysfunction can restore hormone balance. Therapeutic testosterone aims for normal physiological levels, 600-900 ngdl, whereas illicit steroid use can exceed 3,000 ngdl, posing serious health risks. Common myths about testosterone: 30 0034 00. Myth 1. Testosterone makes you aggressive. Reality: normal levels enhance decisiveness and confidence, but aggression stems more from psychological and social factors. Myth 2. Testosterone always causes baldness. Reality: DHT triggers male pattern baldness, and sensitivity of hair follicles is largely genetic. Myth 3. High testosterone causes prostate cancer. Reality: research shows the link is not straightforward. Some prostate cancers are associated with low testosterone. Monitored therapy doesn't raise cancer risk in men without prior history. Myth 4. Testosterone is only for men. Reality: women need testosterone too, at lower levels, for libido, bone density, muscle tone, and overall vitality. Very low levels can cause symptoms similar to men. Myth 5. Masturbation lowers testosterone. Reality: there's no long-term drop. A brief rise occurs around 7 days of abstinence, but levels return to baseline. Regular sexual activity may even correlate with healthier levels. Bonus insight: heavy weightlifting, when done with proper form, strengthens joints and improves flexibility, reducing injury risk. One of the best exercise types for maintaining healthy testosterone. Conclusion: takeaways: 34 0036 00. Here's a quick recap of what we covered today. 1. Testosterone is vital, not just for muscles and masculinity, but for overall bone, heart, brain, and life quality. 2. Balance is key. Avoiding overly high or low levels yields the best health outcomes. 3. Natural boosts work through nutrition, exercise, sleep, and stress reduction. 4. Medical therapy has its place under professional guidance after thorough evaluation. 5. Health awareness matters. Regular checkups help you spot issues early. If you enjoyed this video and found it helpful, please hit like. It helps the channel reach more people. Don't forget to subscribe and ring the bell for new videos. Share this with friends who might benefit and drop any questions about testosterone or other health topics in the comments. I'll answer as many as I can. Coming up next, we'll dive deep into how different workouts affect testosterone, which exercises boost it the most, and how to plan your training around hormones. I'm Mo. Thanks for watching my first video. See you in the next one. Peace and best wishes.